Hi, I'm Dr. Donna, consultant ophthalmologist, Move and Shine Eye Clinic, Uttarahalli. I'll be talking about refractive errors. So, what is refractive error? Like normally, our eyeball is of a certain length called axial length. So, if that is normal, when we see an object, the light rays will pass through the cornea, which is a transparent part in front, what we see as a black of the eye, then through the lens of our eye, and it will fall on the retina, and you see things clearly. But say, for example, like if the eyeball is longer than normal, the condition is called myopia or short sightedness. So then the light rays will not fall on the retina, which has become here. It will fall in front of the retina. So the patient will not see things clearly. So to correct to this refractive error, you have to put a lens in front of the eye so that it falls on the longer eyeball retina. So this condition is called myopia or short-sightedness, where usually kids will not see the board clearly. Distance is not seen clearly, for which they will have to wear glasses. Then there is another condition where the eyeball can be shorter than normal. So then the retina will come in front and the light rays will be focusing behind. So to correct that, you will have to put a plus lens in front. So that condition is called hyperopia or nearsightedness. So both these are refractive errors which we see in children and in adults. So in adults after 40 years, what happens is that the reading becomes blurred. That is because the ability of our eye to adjust to near comes down. The muscles which work to adjust our lens to near becomes weaker with age. Then again you will have to put a plus lens to make the near clearer for our reading distance or working distance. So that condition is called presbyopia. And there is one other condition called astigmatism also, where the light rays will not be focusing at a single point. For example, the horizontal rays and the vertical rays will focus at separate points. So to correct that also, you have to put astigmatic lenses or cylindrical lenses. So in after 40 years, once you get the presbyopic power, there are three options. Like for example, if a person is having a +1 power for reading, they can either wear only reading glasses where the full lens will have that +1 power, or they can go for bifocal glasses where the upper part will be their distant vision correction and the lower part for near, but you will see a demarcation line there. The third option is a progressive lens where you will not see the demarcation line. It will be a gradual change from distance to near. Again, the upper part will be for distance and lower part for near, but you will not see the demarcation line. So these are the three options for presbyopic patients. And nowadays majority of people are working on system, all that. So then the glasses, we can give anti-reflective coating so that the glare from the computer can be reduced and the strain to the eye can be reduced. And again, while working on system, you can take precautions like 20-20-20 rule. What does that mean? Every 20 minutes, take your eyes off the system, look at a distant target, say 20 feet away, at least for 20 seconds. So these will act as micro breaks. So these micro breaks will help relax our eye muscles because our eyes are not meant for prolonged near work, which can strain our muscles and cause eye strain, headache. So micro breaks will help prevent this eye strain related to prolonged near work. Then related to the computer working professionals, they can blink their eyes more often because when you're working constantly focused, your blink rate comes down. Normally, we blink around maybe 14 to 18 times per minute. So that will reduce, and there is a tear film layer covering the front part of our eye. So that breaks down, and you'll get symptoms of dry eye. So to avoid that, they can blink more often, and they can use artificial tear eye drops if the symptoms are disturbing. So, and get the eyes checked yearly once. And for kids, we usually advise 6 monthly check. Why? Because the power can change as the kid grows, the eyeball also grows. So the power can change in 6 months. So better a 6 monthly check for kids. Thank you.